Alrighty. I've already gathered my supplies and performed hand hygiene and donned on gloves. Now I'm ready to get this assessment started. Hi, I'm student nurse Gutierrez. My name is Elizabeth, and I'm going to be doing the head tonight. Is that okay with you?
Yes.
Alrighty, what is your name and date of birth?
Caitlin Plato, date of birth 9/11/2000.
Alright, do you have any allergies?
No.
Alright, let me see. Alright. So, can you sit up for me, please?
Yes.
Alrighty, my patient is now in the correct position, so we can now move on with this assessment. So, she's upright and relaxed, which is expected position. Her facial expressions are appropriate for time and place. Her skin is the correct color for her ethnicity, and can you tell me what you've eaten within the last 24 hours?
For breakfast, I had yogurt. For lunch, I had a sandwich, and for dinner, I had mashed potatoes and roast.
Alrighty. She seems well nourished, and she has proper dietary intake. No unexpected findings there. Her mood is calm and cooperative, and she doesn't seem to be having any trouble with speech or hearing. So, can you tell me where you are?
The hospital.
Can you tell me the date and time?
October 1st, around 8.
Alrighty. And can you tell me what brings you in?
Just to get an assessment done.
Just an assessment? Okay. My patient is oriented times 4. Her hygiene is proper for time and place. She is well groomed and clean. Okay. Now we're going to be moving on with her measurements. On a scale of 0 to 10, can you tell me your pain levels?
0.
0? Okay. Can you tell me your height and weight?
I'm 5'6" and around 195.
Okay. And your pain, your height and weight. Can you also tell me if you prefer an arm for blood pressure?
Either one is okay.
Either one? Alrighty. I will be doing the 2-step process. I have already placed the cuff on the correct hand. It is the correct size. It is snug. It is also in the correct position, 1 inch above the antecubital area. So I'm going to be palpitating for the brachial artery, as I can already see it right here. All right. Alrighty, this is the time where I would clean my stethoscope and wait 1 minute. I would also clean the blood pressure cuff if necessary, but that was already done previously. Alrighty. Okay, I will now be taking her heart rate. Alrighty, I will now be taking her temperature. This is the time where I would clean the thermometer and place the probe. And then, can I get you to open your mouth for me? Can I get you to put your finger on the probe? Okay, this is the time where I would throw away the probe, disinfect and clean the thermometer depending on the facility guidelines, and then this is when I would be taking her O2 step. So, alrighty, I have now taken all her vitals, and I'm gonna be documenting that now. But everything was within expected ranges. No hypertension, no tachycardia, no apnea. Everything was within expected range. Alrighty. So, like I said in the beginning of the video, I'm wearing gloves. So I'm gonna be now palpitating her scalp. I'm gonna be palpitating her scalp. Is that okay? Okay, so no bumps, lumps, or lesions. The scalp is clean, so no unexpected findings. This is where I would perform hand hygiene and don on new gloves. Okay, I'm going to be palpitating your maxillary and your frontal sinus. Is that okay? Mm-hmm. All right. Did you feel any tenderness? No. Okay. I'm going to get you to smile and frown for me. Alright. She showed no tenderness, and I didn't feel any inflammation on her maxillary and her frontal sinuses. So everything was expected. And she has good facial symmetry. She has the nerves are good. She had no trouble smiling or frowning. So now we're going to be moving on with the eyes. Alright. So she has a pupil size of 4. And then I'm going to get you to look at the pen, look at the wall, look back at the pen, look back at the wall. Okay. Are you ready? Mm-hmm. Okay, look at the pen, the wall, the pen, the wall, the pen, the wall. Alright. And now I want you to follow the pen with just your eyes. Is that okay? Okay. Alright. Alright. Now tell me when you can no longer see the pen, okay?
Okay.
Robin.
I can no longer see.
Now we're going to do that.
Okay. I can no longer see.
Alright, now I'm gonna flash light in your eyes. Just look straight.
Okay.
Alright. Now we're gonna be doing the other eye. Alrighty. Can I get you to pull down your eyelids for me? Alright. So Perla was noted, no unexpected findings with the eyes. And her sclera was shiny and white. The eyelid color was pink, a correct shade of pink, and no unexpected findings so far. Okay, now we're going to be moving on to the ears. I'm going to be palpitating her external ear, and I'm also going to be inspecting it as well as her internal ear canal. Alright, so far so good. I'm going to be checking the other side. Alrighty, no unexpected findings, no lesions. It wasn't dry or flaky. Everything was within expected findings with the ear. Now I'm going to be performing a whisper test. I want you to cover one ear, and I'm going to whisper 3 words. Just tell me what the 3 words are. Okay, are you ready? Pancake, truck, red.
Pancake, truck, red.
Yes. Now we're going to be doing the same thing with the other ear. Yes, thank you. Hot pink car.
Hot pink car.
Yes. So she seems to have no difficulty hearing. Everything so far has been within expected range, expected findings. So now we're going to be moving on to your nostrils. Can I get you to look up for me? Alright. Everything looks good. I'm going to get you to press one nostril and inhale. Okay, same thing with the other nostril. No abnormalities within her nasal cavity. We are going to be moving on to the mouth and throat. Can I get you to stick out your tongue and say okay? Her tongue, throat, teeth, everything is within normal ranges. Her tongue and cavities are moist. So everything looks good so far. Now we're going to be moving on to your neck. I'm just going to inspect it. Okay, everything looks good. No lesions, and I'm checking to see her jugular vein now. Okay, it doesn't look inflamed. Everything is so far within expected findings. No inflammations, no lesions, no rashes. Everything is good. I'm going to be checking her carotid pulse. So can I get you to look that way? Alright, can I get you to look this way? Alright, now I'm going to be checking her cervical lymph nodes. I will be doing this in circular motions. Okay, everything looks good. I'm going to apply pressure on your shoulders, and I'm going to get you to shorten. Okay? Okay, her cervical lymph nodes are not inflamed, and she can shrug even with resistance, so no damage there. And I'm going to get you to look side to side, up and down, and all around. Can you do that for me, please? Alright, and that's it for the assessment. Are you in a comfortable position?
Yes.
Yes, here's your call light. Do you need anything from me before I leave?
No, I'm good, thank you.
Okay, this is when I would take off the gloves, perform hand hygiene again, and I'll tell you my vitals. But everything, she was a healthy individual, no unexpected findings. Blood pressure was 110/70, heart rate was 80, respiratory rate was 20, temperature was 97 Fahrenheit, and then O2 stats was 99.